Hi, I'm Libby. I'm a speech pathologist at Cooey Speech Pathology, and today I'm going to talk to you about feeding. We've had a lot of questions and discussions in our clinic and also with clients recently around what are we talking about when we are saying feeding therapy. So, when we eat or drink, there's lots of different steps that our body goes through automatically for most people. We bite, we move our food with our tongue, we chew with our teeth, generally at the back. We close our lips, use our tongue and teeth to move the food to the back of our mouth, and we engage our swallow reflex. Sometimes children will have difficulties sequencing and using all of these movements and being able to develop all the skills for eating. There can also be some sensory preferences that go into feeding difficulties as well. So, speech pathologists and occupational therapists can become trained or seek out extra training to help address and deal with feeding difficulties. So we can divide our feeding difficulties into two kind of main categories. There can be feeding difficulties, which are sensory and oromotor difficulties, and swallowing disorders. We would classify the latter as a feeding disorder. Speeches are trained in identifying and treating swallowing disorders, but it is best done within a transdisciplinary, multidisciplinary team within a medical setting. This is because swallowing disorders can lead to something called aspiration, where food goes into the lungs, and it also can have quite a significant risk for choking. We feel that including doctors, OTs, physios, dietitians, and nurses are really important in treating a feeding disorder. And if you find that your child is coughing or choking quite frequently after eating, we recommend that you seek advice from your medical team or a GP to guide you as to who will be the best person to help assist with that problem. So we offer support with feeding difficulties. Sometimes people will call these kids fussy or picky eaters. So when we're talking about fussy or picky eaters, we're talking about kids who have difficulties transitioning to different types of food. So that could be transitioning from puree to solids. It could be transitioning into a puree, or there could be a rejection or a refusal of new foods that are presented as well. There's also a tendency that these children will have a limited food repertoire. And what we mean by that is less than 10 foods in particular categories, like our proteins and dairies, our starches, and fruit and vegetables. So if there's less than 10 foods in there, we would tend to classify those kids as picky or having some feeding difficulties. Another indicator of feeding difficulties are when children will gag on particular foods. And this is where you can gag at the front when food touches the front of the mouth as well as the back of the mouth. And just to clarify, gagging is different to choking. Choking is where the food has gone down the airway and a child cannot breathe. Gagging is where it's a sensory response or sometimes a motor response to the introduction of a new food, and we're just trying to get it out. But the food hasn't actually gone down either our esophagus, where we swallow food, or down our windpipe, where that causes an obstruction and leads to choking. So the other thing with feeding difficulties is there can be difficulties with chewing and moving food around the mouth. So that's all of those aspects that are needed for eating: the bite, the chew, the moving of the tongue, and moving the food down to the back of the mouth for a swallow. There can also be just lengthy and really difficult meal times, which can be really stressful, not only for the child, but also for the whole family. Feeding difficulties are tricky, and it is really important that you seek out the right people at the right time to help support you with your feeding journey. So at Cooey, our speechies and OTs can offer support for like strategies for family meal times, sensory strategies for trying new foods. We can also have our feeding sessions where we're exploring and expanding food repertoires. We can also assist with the oromotor components that are needed for biting, chewing, and swallowing. It's really important for feeding to seek trained therapists that are comfortable providing feeding therapy and information around it. We do really want to note, though, that any sudden and rapid weight loss, sudden loss of appetite, ingestion of food, or obstruction of the airways is within that, they can be quite significant and quite serious, and it is best to seek a medical team and your GP. This is just a general overview of how Kui can help with feeding and the difficulties that we might see.